she's using her medicine less because she wants to get less side effects, and glutathione doesn't have any side effects. On the contrary, it has so many benefits besides what I just mentioned. So she's getting very good results, very, very good results. She's very pleased. And I think glutathione is one of my favorite IVs.
Yeah, me too. I mean, glutathione is a very powerful antioxidant. Hi, I'm Dr. Christi with LifeSculpt by Christimd, and welcome to the podcast. We're so glad that you're tuning in again, watching us on YouTube, wherever you're finding us on Spotify or Apple Podcasts. We're so glad that you're joining us today so that we can educate you further on the optimal health and vitality, everything starting from urogynecology to intimate wellness and way beyond. And I'm super excited today to have a very special guest. It's our very own Guadalupe, who is our IV technician specialist. She's a certified medical assistant and an IV technician. She's been doing IV therapy for many years, and she is not only is she technically very, very good at inserting IVs practically painlessly, but she's also very expert in the various ingredients that can be put into IVs and what our patients need. And I lean on her quite a bit to help me recommend the IVs for my patients. So we're so glad to have you today, Guadalupe. Welcome to the podcast.
Thank you, Dr. Christi.
Okay, you're welcome. You're welcome. I'm so glad you're here. Okay, so I wanted to just give you a minute to share with our audience what you were telling me earlier about, how you got into IV nutrition therapy, how many years you've been doing this now, and what really motivates you to keep going every day, what you've observed with your patients over the years.
Okay, sure. Well, everything started 15 years ago. My husband got a promotion and we had to move to Austin. So I left my job of 13 years in the medical center, and we moved to Austin, and I started looking for a new job. And I found this job with a gastroenterologist who was doing IVs for nutrition, for detoxification. And I'm talking about 15 years ago, before all this booming of IVs came on. So why I'm passionate about it? Because I see it's very rewarding. I see patients getting better. Even though at the beginning, when I started doing all this, I was skeptical because, it's very hard nowadays. Doctors, they are very busy and they don't look for the root of the problem. So when you look for the root of the problem and you give them exactly what your body is needed, it's unbelievable how much help an IV can give you. That's why I'm so passionate about it.
Yeah.
It's very rewarding.
Yes. Yeah. And, personally, I've had IVs myself and have noticed a huge difference in my health. And I've seen it in many of our patients all of our patients that have done IVs have really noticed a big difference and can really experience the benefit of it at a cellular level. So let's back up for a minute. And could you explain to the audience what do we mean by IV nutrition therapy? We see a lot of IV drip spas popping up, and maybe people aren't aware of what this is. It's something that's sort of outside of insurance-based medicine. So a lot of doctors don't really talk about it or promote it. But can you explain to the audience what IV nutrition therapy is and how it helps the body?
Okay, well, here at Dr. Christi, at LifeSculpt, we really emphasize of doing micronutrient testing to see exactly what your body is needed, because we can customize. You might be lacking vitamin B, C, minerals, antioxidants, and so we can add all that into the IV, so you can get 100% benefit of it.
Yeah, exactly. And explain how why IV nutrition therapy can be better than oral supplements a lot of the times.
Okay. Well, first of all, because it goes straight into your bloodstream, it bypasses the GI tract, and you will absorb 100%. Sometimes we have a lot of bacteria in our stomach, and depletes, all the power of the vitamins that we take, and we don't absorb them, or they are not medical grade. That's another thing that we have to be careful while we get out there. So the benefits of getting an IV straight into your bloodstream with the vitamins and the minerals and antioxidants that you need is amazing.
Yeah.
It's a big difference.
Yeah, way better absorption into the cell, into the
Right.
cellular level throughout the body.
Exactly. A lot of patients sometimes they say, well, Guadalupe, I take, medical upgrade vitamins. I eat organic. And I say, yes, but remember, what we eat, it doesn't have the nutrients and the minerals that we used to have 100 years ago, 50 years ago, because the soil is already depleted from them. So that's why the IV is a big difference.
Yeah.
It makes a big difference.
Yeah, it does. And I think to your point, really evaluating what micronutrients we need. And the testing that we do, it's not just a snapshot in time, what's in the bloodstream at the moment. It's kind of what's been accumulating in the cells over the last few months. So we can be very targeted in how we replace that. And not just kind of, if you go into a lot of IV drip spas, it's just kind of, okay, well, let's try this one. We're going to try, this one. And we'll do that if someone doesn't want to do the micronutrient testing, but we really recommend the micronutrient testing because then we can be very targeted and can really develop a formula specifically for that patient. So let's take a second and just let people know, what can they expect during the treatment? What is it like when you get an IV drip?
Well, you come to our office and we have this beautiful lounge area with very comfortable recliners, beautiful view. And I talk to the patient so they don't feel very nervous. And I think when they see and then hear me, I've been doing this for many, many years. I'm very gentle and I can answer all the questions. And after that, after a few minutes, the patients, they relax, they get in the recliner. I get the IV ready for them, and then just, insert the IV, a needle, very gentle. And we bring them water. We recommend, if not to be fasting, to have something in the stomach. But if they're fasting, we provide, with healthy snacks and water so they can feel comfortable and don't get nauseated, things like that.
And then how long does it take to get the infusion?
Well, it depends. If it's the first time, I like to do it slow. I know a lot of IV drips, they go like, super, super fast. And I'm coming from an old school. So, and we have a lot of studies out there that we have to do slow because we have to give it time to the cell to absorb what you are getting. We're not going to rush and go fast. Let's give it some time to your body to absorb. Another recommendations that we like to do is think about what you're getting in your body. Think about, the benefits. Mind and body is connected. So you have to think about that so you can get better benefits. So they feel very relaxed. They're very relaxed in the IV room. 45 minutes to an hour, I would say. Yeah. It depends on the IV, but that's what it times, 45 to an hour.
Yeah. And then you can just go and do your regular activities. There's no restrictions afterwards.
No.
You can exercise, go eat a regular meal, whatever you want to do after that. Go back to work, whatever.
You can even sleep better. A lot of patients that say they sleep better when they get the Myers because it has magnesium, relaxing them and all that stuff.
Yeah. Myers is one of the top IVs that we recommend. It's got the magnesium in it. What else is in it, Guadalupe?
Vitamin C. And this is very, very important. We do not use corn. Vitamin C comes from tapioca, from a root. The reason that we don't use corn is because corn is modified already and it causes inflammation. And we are preventing inflammation, so we're not going to use corn in our vitamin C. So it has vitamin C, magnesium, zinc, calcium gluconate, B complex, and B12.
Good. Yeah.
And we can add other stuff. We can add biotin. We can add alpha lipoic acid. Depends of what the patient needs. But the basic measures is vitamin C, zinc, and B complex and B12.
Yeah. And some of the conditions that we treat that IV nutrition therapy can be very helpful for is to enhance weight loss and metabolism, to improve the glow of the skin, help the skin health, to improve recovery from surgery. By building up the vitamins in the body before and after surgery so that the body can heal more quickly and hydrate the body. They're also really good for autoimmune disorders.
That's correct. Yes, ma'am.
And improving the energy and vitality and to boost the immune system.
And to boost the immune system. Yeah.
What are some of the top results that you've seen with patients where I'm thinking of one right now. I'm thinking of one of our team members here who has psoriasis on her leg.
That's right. Yes.
And she did IV nutrition therapy. What did you put in her IV, Guadalupe?
She got glutathione, which is the mother of all the antioxidants. I love glutathione because it removes, everything that our body doesn't need, even heavy metals. So what we're doing in this case, she gets high dose of glutathione. We start, from 500 milligrams, 700 milligrams, and we got to 3,000 milligrams of glutathione once a week to remove and help with inflammation because she has a lot of inflammation and a lot of toxicity in her body. And also glutathione enhances her immune system as well. So she's using her medicine less because she wants to get less side effects, and glutathione doesn't have any side effects. On the contrary, it has so many benefits besides what I just mentioned. So she's getting very good results, very, very good results. She's very pleased. And I think glutathione is one of my favorite IVs.
Yeah, me too. Glutathione is a very powerful antioxidant, and there are some preparations that you can take orally. They do not compare to the IV. The IV is going to be so much more effective. The other one that I think is super powerful for anti-aging, I don't really like that term anti-aging, but you could call it regenerative medicine, is the NAD+.
Right.
Yes, and we offer that as well, which is really good for helping you if you're feeling kind of sluggish, if you're starting to feel your age more than usual. The NAD+ is very powerful for that.
That's correct. So we need to maintain, just like the glutathione, we need to maintain glutathione level high in our blood. NAD, we need to maintain that also in our body. And it's called the anti-aging because the mitochondria send signals to the other cells to rejuvenate, to make more new cells. NAD is very important for our body, for our neurological system, for all the cells in our body. When we reach over 30, we don't make enough NAD, so we start declining and seeing signs of aging. But if we maintain the NAD high and a good level, then those cells, they're going to keep, rejuvenating, making more new cells. So that's why it is important to maintain those cells, those levels high of NAD+. Dr. Christi, she is conservative. We don't like to use a high dose of NAD because it takes 3 hours, 3 hours and a half. So we use, 250 milligrams, 100 milligrams, and the patients, they are doing fantastic. Especially the patients that have chronic illnesses like Lyme disease, Parkinson's, a little bit of dementia. I mean, they are seeing very, very good results when we keep that and maintain the NAD level high. And also, it is important after the NAD to give them a push of glutathione to remove all that toxicity, because that also affects our cells, and our cells that don't make NAD plus.
Yes. Yeah, I started really looking at the research on NAD a few years ago. And it, for any kind of supplement or treatment that is touted as anti-aging, there's only time is going to tell, right? Like, how are you going to do a human study? It's going to take decades to do a human study. So they do animal studies, they do mice studies primarily. And the NAD, the mice that received the NAD were noted to live longer and be healthier. They had a smoother coat. They had more energy. They didn't get the fat deposits as the mice that did not get the NAD. So I thought that was very compelling and really showed me the power of NAD+. We're almost out of time. I did want to encourage all our listeners to, if you're watching on YouTube, to please like the video if you like it, and feel free to ask any questions. I do try to respond to questions as much as I am able. Subscribe if you're not already subscribed to our YouTube channel, and if you're listening on the podcast, please share it and also subscribe so you can be updated whenever we drop a new episode. The last thing I wanted to ask you, Guadalupe, is are there any side effects, anything that people need to look out for if they're doing IV nutrition therapy?
No side effects whatsoever. And that's what I tell my new patients. No side effects, because that's the first thing they ask you. What side effects I'm going to experience? And I say none. I have been doing IVs for 15 years and I have not seen any side effects, and you are not going to be the first one, okay? So no side effects whatsoever. That's why we have to be very careful with high dose of vitamin C to give instructions to the patients to have a big meal on the stomach, because vitamin C tends to make the patient hypoglycemic, to bring the glucose down, and they start feeling sick. And that is very important. So, or with a high dose of glutathione, if they get a very high dose of glutathione the first time, they're going to feel sick. So that's why it's important that the person who is administering the IV, they know how much and all that stuff. But no side effects whatsoever.
Yeah, I mean, and that's a credit to Guadalupe's skill, because there is, I mean, if you don't go to a good reputable place, you can get infection or inflammation in your vein. You can get unnecessary scarring in the vein. So you want to go to a very good, reputable clinic, preferably with a doctor, that's there overseeing everything, and someone with experience like Guadalupe. It's not really a side effect, but I have noticed when I get IVs that I'll taste, like sometimes I can taste some of the supplements in my mouth, but that's not really a side effect. No. But people, like the first time, they may not be aware of that. They may think, "What is that?"
Right.
But it's nothing bad.
Right. And I'll be sure to tell them. Most of the times I do tell them, do you start tasting the vitamins? And the majority they say, yes, yes, I do. I said, that's normal. I don't want you to start,
And also, someone that has a lot of medical conditions, especially if they have a heart condition, a lung condition, you do need to be careful with IV nutrition therapy, especially congestive heart failure. You can give too much fluids. So that needs to be taken into consideration for the patient. But other than that, it is very safe, especially if you're in good hands like Guadalupe. And we're so glad that you're here. Thank you, everybody, for tuning in. I hope you learned something from this podcast. And I hope that we will see you on the next one. And just have a wonderful and blessed day. Bye-bye.
Thank you, Dr. Christi.